We've heard a lot in recent weeks about how frontline policing has responded to COVID, and I wanted to give you perhaps a different insight into what is meant by frontline by introducing to you Luke and Paul. Luke and his colleagues answer 1,000 or more calls every day for the public and are not quite sure on any call what they're going to listen to next. And Paul and colleagues have got the job in the force control room of responding to all of those incidents, and of course life has been very different for Luke and Paul and colleagues over recent weeks. So Luke, Paul, thanks for joining us guys this afternoon. Really appreciate your time, and you know, life must have been quite different for you in your roles during COVID. So Luke, how have the calls changed over the last few weeks?
I think it's more the demanding calls that we've got at the moment. So you still deal with the original stuff that you dealt with before, sort of the crimes in progress, antisocial behaviour. I think it's more the increase of obviously the COVID-19 kind of calls you get. And that's the main issue, is how many calls are coming in on top of what we already dealt with. Yeah. And trying to manage people's expectations in that sort of way. So 90% of the stuff that come in mainly via emails, and obviously things like 101 calls, the increase in that has been quite drastic since this has come in.
Yeah, of course a lot of people have been reporting online, haven't they, on electronic systems, and lots of questions about COVID, and I guess increasingly now the regulations have changed. We're looking to people to, you know, make the right decisions for themselves to stop the spread of the virus and keep themselves safe.
And I think that's the issue. You get people asking, am I able to travel this distance to see my family? We aren't able to give that kind of advice. We're just going off of what we've been told as well.
Yeah, sure. And Paul, I suppose your office, so to speak, is just up here in the force control room. And you've been working with us for quite a number of years and a lot of experience in there. So what changes have you noticed in how we're responding to incidents?
The jobs that are coming out to us are more ASB, more antisocial behaviour, more violent crime, and obviously people reporting breaches of COVID guidelines. And we've seen a massive increase on that at the moment. I'd like to say about 95% of Surrey are adhering to it, but unfortunately there's some that aren't, and we're trying to respond to that best we can, whilst on top of dealing, you know, with people whose lives are at immediate risk.
I'm sure you are. And as the regulations start to change, what advice would you have for people knowing the sort of incidents you've been dealing with over recent weeks?
It's just taking that extra second to just sort of stop and think what you're doing, where you're going, who's around you, just to keep your social distancing, and, you know, be sensible. You know, a lot of the calls that we get in that have been obviously in the media of people drinking and around, you know, Frensham ponds and things like that. That understandably upsets people, and we need to be there to make sure we're enforcing, you know, government guidelines.
Yeah, sure. I suppose it's about being a good neighbour in open space, isn't it?
Exactly. I mean, that's one. You know, you can always look for positives, and that's one thing I have noticed is neighbours are keeping an eye on each other nowadays, whether that's for good or bad, you know, whether they've got a concern about elderly neighbours or whether it's, you know, neighbours breaching guidelines. So.
Yeah, sure. And I guess it's all about us trying to keep healthy, keep communities healthy, avoid the virus, and we've been pretty successful in keeping sickness rates low in the office. What's your environment up there like now to keep that social distancing?
Well, we're split into two now, so so in case anyone, unfortunately, you know, fingers crossed it doesn't, but if anyone does come down with symptoms, it doesn't mean that our whole rota, because there's, you know, up to 18 of us up there, and if one person displays symptoms, then that could be potentially 18 people out. So yeah. To prevent that, we're spread across two rooms. So there's some of us up there, and there's some further down the hill there, yeah. In what we have as our backup control room.
Luke, I know in the contact centre, I haven't been in there for weeks, which is you know, unusual because you're trying to restrict the number of visitors, but you've got the screens up as well, haven't you?
We have 3 different locations set up. We have people obviously with ourselves here. We have another location in Guildford and also another building where we are now. I think that makes it much better. We do obviously have a one-way system as well going through, so you obviously got to enter in one way, you've got to exit out a different way, and it's got to stay like that continuously. It just stops, you know, the impact of us going around the room and trying to make sure that we don't, you know, walk around the same places twice, 3 times. And it's similar to what Paul was also saying, you know, we have so many people working in the contact centre. If one person comes in feeling sick or anything like that, it has a big impact on everyone else, which is why we're trying to reduce people sitting next to each other. You have desk in between, just that sort of social distance in between each other, trying to make sure that we are keeping away from each other and, you know, sorting that issue out.
Well, as I say, a huge thanks. Is there anything that you wanted to ask me whilst we're together for our sort of brief chat?
Yeah, I was just wondering, sir, if there's anything that you think, you know, going into the sort of future, how we're going to progress with this, if there's anything there at all that's been updated, or?
I think we're all keen to get that freedom back, but I think we need to recognise that this isn't over yet, is it? The new testing and tracing systems that are coming in, we've got to give that time to take hold, and of course for the medical experts to find sort of more long-term answers to that. So I guess despite that freedom, within the major incident response that we're doing, and I was chairing a meeting earlier today, we're still really keen for people to, as you were saying earlier, Paul, have that responsibility to look after each other, even if you are in sort of public open space or having some friends around. We really got to stop the virus spreading. And from a policing point of view, we're sort of in between two things at the moment. We're trying to get back to life before COVID in terms of the crimes and incidents that we were dealing with and investigating, and there's certainly more of that coming in, as I'm sure you've noticed. But at the same time, play our part in looking after vulnerable residents, many of whom are still shielded and still need day-to-day support in terms of food and medicines and so on. So there's definitely a lot of hard work still to come, and I'm just so grateful for all you and colleagues have done over recent weeks. Thanks very much indeed. As we move into the next phase of the crisis, Paul and Luke specifically asked me to ask you to be good neighbours to each other and to look after each other, particularly in public open space as we get our freedom back. Because it's now, I guess, over to all of us to be responsible to stop the spread of the virus, as there's less enforcement that policing is going to be able to do. So really appreciate all your support on that.